Hello everyone and welcome to today's video. So today we're discussing a topic that many women experience but might feel unsure about, and that's the area of vaginal discharges. Now it's important to understand what is normal and what changes might signal something is off. In this video we're going to explore the different types of discharges that cause changes to the vaginal environment and how you can address the imbalances both naturally and with medicinal support. Now first of all, let's talk about what's considered normal vaginal discharge. The vaginal cavity hosts a wide range of healthy bacteria, primarily from Lactobacillus genus. Now these bacteria help maintain the balance of the vaginal microbiome, which is influenced by factors like hormones, glycogen and pH levels. Now normally vaginal discharge is clear to white, slippery, slightly sticky, and it amounts to about a teaspoon per day. The amount and the consistency can vary depending on where you are in your menstrual cycle. So for example, the discharge tends to be a little bit more slippery and stretchy during ovulation. Now sometimes changes in the vaginal discharge signal an imbalance or an infection in the vaginal microbiome. So let's go through some of the most common causes. First of all, there's bacterial vaginosis, which is caused by Gardnerella vaginalis. It often leads to thin, frothy, grey discharge with a strong fishy smell. There's vulvovaginal candidiasis, which is thrush, and it's a yeast infection that results in a cottage cheese-like discharge and a yeasty smell. There's trichomoniasis. It's a parasitic infection that causes a frothy yellow-green discharge with a fishy odour, and it's often accompanied by itching and pain during intercourse. Next up is chlamydia and gonorrhea. Now these are sexually transmitted infections or STIs that cause yellow or green discharge and pain during urination or intercourse. There's atrophic vaginitis, which is often seen in postmenopausal women, and this is due to low estrogen levels and usually causes dryness and discomfort. Now, several factors can disrupt the balance of the vaginal microbiome and increase the risk of infections or discharge changes. There's hormonal changes, such as those during menstruation, pregnancy, or menopause. There are the kind of habitual use of douches. This is kind of like a vaginal wash, scented soaps, and I've seen some on Etsy for vaginal soaps, or hygiene sprays, which can irritate and disrupt the natural balance. Fundamentally, they're not things that we would recommend, and certainly not something that we stock. Wearing tight clothing or synthetic underwear can help trap moisture. So it's better to use something that's organic, natural, or silk. Sexual activity, especially unprotected sex or frequent intercourse, can lead people more at risk to changes in the vaginal mucosa. And then poor diet or a high sugar intake will lead you to feed any yeast overgrowth. Lastly, stress and lack of sleep will affect your immune system and your resistance to be able to fight any infection that it starts to take hold. Now, when it comes to natural treatments, the focus is on restoring healthy vaginal environment, promoting proper mucous membrane health and addressing any infections or imbalances. Now, some helpful herbal remedies include pelvic circulatory stimulants, mucous membrane support, and to help treat the infection and stimulate the immune system. So first and foremost, the pelvic circulatory stimulants. These are herbs such as yarrow, black cohosh, lady's mantle, which all improve blood flow and support healing. For the mucous membrane support, we want to use herbs such as marshmallow root or shatavari, which help nourish and hydrate the tissues. Then to treat the infections, so antimicrobials such as garlic, uva ursi, thyme, calendula are really effective. Now, a garlic clove, whenever inserted vaginally, unbroken, to avoid skin irritation, can be really helpful to fight yeast infections. Essential oils can also be used in pessaries. These are vaginal suppositories for treatment. We would use herbs such as tea tree, lavender or calendula and thyme essential oils, which can be applied using a pessary to help fight infection. Now, these oils are potent and they need to be diluted properly before use. Now, restoring balance to the vaginal microbiome is key. Using probiotics or applying a plain yogurt with live cultures vaginally can help re-establish a lactobacillus dominant environment. So along with probiotics, it's important to feed your good bacteria with prebiotics such as garlic, chicory, asparagus and bananas. Now, supporting your immune system is also essential. Herbs like echinacea, calendula and andrographis can help your body fight infections much more effectively. Your diet plays a big role in maintaining vaginal health. So a diet rich in vegetables, fermented foods and garlic can help keep your microbiome healthy. Try to avoid sugar as it can help feed yeast and disrupt the balance. Drink plenty of water and consider washing the external area of the vagina with apple cider vinegar, diluted in water to maintain proper pH levels. However, I really wouldn't be recommending to do that internally. Now, be mindful of what products you use around the vagina. Avoid scented pads, tampons and soaps, which can irritate the delicate tissues. Opt for things that are natural and unscented products whenever possible. If you do notice changes to the discharge that come with itching, pain or strong odour, then it is a good idea to consult a healthcare practitioner. Infectious diseases like chlamydia, gonorrhea or trichomoniasis need medical attention, and it is important to rule out serious conditions like cervical infections or even cancer. Now, vaginal discharge is natural, it is healthy, it's part of your body's cycle. But when something feels off, it's important to listen to it. So whether you choose natural remedies or seek natural treatment, understanding the cause is the first step to finding relief. And I would point you right back to notice the change in smell, colour and texture of any discharge that you might have. Now, thank you for watching. Hopefully you find this has been helpful. If you wish to share it, like and subscribe it to people who may benefit, then please do so. And just remember that your health matters and taking care of your body is always a priority. Take care, and I will see you on the next video.